Achoo! Don't you just hate the cold? What is the cold? It's a viral infection or an upper respiratory infection. It affects the eyes, the ears, the nose, and the throat. Common symptoms of it is the fever, body aches, extreme tiredness, dry cough, runny nose, sore throat, congested headaches, and ear pain. How do you know if you have the flu or not? Your runny nose. If you have a runny nose, that means you have a cold. If you don't, you have the flu. Go to the doctor. Recovery process. Well, the common cold lasts up to 2 weeks. The first 7 days is the contagious stage. The next 7 days is the stage where you have the symptoms and it's almost up. Your cold will stay for 2 weeks. There's no way to shorten the process. Time heals all. For the recovery process, you'll get plenty of water, plenty of rest. Use a humidifier, over-the-counter drugs. Avoid smoke. Do not smoke. Secondhand smoke, no. Or any air spray. Specific to these things, because some people don't have all of them. So if you have a sore throat, you probably want to take some ice chips or sore throat spray or humidifier or over-counter drug. For ear pain, you can use a warm compress over the ear that hurt, and that should relieve some of the pain. If that doesn't do it, then you can take over-the-counter pain reliever. Runny nose. If you have a runny nose, you can use nasal saline spray or a decongestion. For sinus pressure, you can use a warm compress over your head and your nose, and it should relieve some of the pressure. If it didn't, then you can use a over-the-counter drug. If the humidifier costs too much for you, you can always use take a shower or boil some hot water, put it in a bowl and breathe in the hot air. That's the same thing as a humidifier. If you don't take pain reliever, you can drink hot peppermint water and it should relieve some of the pain. Some over-the-counter medicines that you can take is ibuprofen or naproxen, and it should help you with the pain. For children, please do not give them aspirin. It'll make them really sick, and just don't use it. Or children, you don't even have to give them medicine because you're trying to build their immunity. But if your child absolutely needs some medicine, give them a lower dosage than recommended so your child can build that immunity. For all over-the-counter drugs, follow direction on the over-counter drugs or use as directed. To prevent this, you can always wash your hands with warm soapy water and for about the length of the ABC song. So you wash your hands for the whole song of ABCs. Cover your mouth when coughing or sneezing using your inner arm like this. And avoid people with the symptoms. Take your vitamins. Get the flu shots. And that is recommended for 6 months of age and older. Even pregnant women can get it. Routinely clean surfaces, doorknobs, or phones and keyboards. And all of this information that I just gave you, I got it off of https://www.cdc.gov/flu/about/coldflu.htm. And thank you for watching How to Prevent a Flu.